Early on in my practice, literally the first couple of months, I attended a seminar with MT Mortar, with the Mortar Health Systems. MT Mortar now has passed on, and his children have continued on and doing good work with that technique. As we all do with the different techniques that we learn, we mutate them and use them in our own practice in different ways, and I use a bit of their information now and have added it with other concepts, but it affected me, and it's helped me so much to be able to work with patients and help them let go of emotion. A lot of us don't really know what to do there, and I'm hopefully tonight will give you some ideas and empower you to be able to work with your patients tomorrow in helping them to get rid of conscious and subconscious emotions. There are a lot of techniques out there, and this by no means is the end all, but it's an idea, and hopefully it will help you as well. This is me, and I'm a chiropractic physician. I specialize in health and well-being as a wellness coach and help other doctors as well to create wellness centers. So tonight we're going to be discussing the triangle of health, and specifically one side of that, which is emotion. So we'll talk about that in a minute, but in this presentation, healing through emotion is where we'll be going. So emotion can be the enemy. If you give into your emotion, you lose yourself. You must be at one with your emotion, because the body always follows the mind, according to Bruce Lee. So absolutely, your body will follow your mind, follow your emotion. In my opinion, we create our field, the aura, if you will, our spirit is what is the blueprint for how our body functions and acts. So if we have troubles within our spirit, our essence, because of emotion, it will set up a false pattern of function throughout the rest of the body, and then disease is what appears. So the triangle of health that I work with in my office here is structure, emotion, and physiology. As a chiropractor, I want to make sure that their structure is the best that it can be, that their feet are in a good position, a good neutral position, because I believe that it starts with your feet and how you are centered on the floor, which then connects to your ankles, to your knees. The knee bone is connected to the hip bone, and the hip bone is connected to the sacrum, and if the sacrum is unlevel, then the spine isn't going to be able to be leveled. If the spine is curved, then it's going to wear down. Of course, the spine is the conduit of it's the conduit that holds the brain and the spinal cord. Spinal cord, of course, is a projection or a continuation of the brain. And so if that conduit is bent or wearing down because of its lateral curvature side to side, or whatever reason, anterior weight bearing or whatever, it's not going to work correctly. So structure is where we start with. So the triangle of health then, a measure of our body's overall health, and which can define how the body can cope with external stress. So we start then. Some consider the health triangle to be mental, physical, and social, but social can be a component of emotional health. Okay? So we start then with structure. The mechanics of the musculoskeletal system, joints, soft tissue, and their influence over the nervous system. If those joints aren't working right, the disc tissue diminishes, and the disc is what holds the vertebra apart, causing the foramina, or the holes on the sides, which allow the nerve root to pass through that hole and then go to different organ systems. So if that hole is being compromised by whatever diminishment in the structure, then you've got trouble. So chiropractically, I work with structure. The body's biology and function from its organ systems, cells, and chemical function. So this would be layers of infection, organ systems, just how the overall physiology functions. And then lastly, the state of mind derived from one's circumstance, mood, and relationship with others. That's emotion. So in this presentation, we'll focus on ways as practitioners that we can aid the emotional health of our clients. And effective balancing of the emotion side of the health triangle is important, as it allows for more effective body function. So we've got to be able to work with the conscious and subconscious emotion, because that's where most of it resides. So why is emotion important? The emotion controls most of the autonomic system. So remember, in the autonomic system, there are two sides of the pendulum swing. If you can imagine a pendulum swinging, one side is sympathetic, uptight, fight or flight, gas pedal. Swinging down and across to the other side of the pendulum swing is parasympathetic, Parasympathetic is more of the brake, digestion, relaxation. So if you're running from a bear, you want to be in sympathetic dominance. That's running from the bear. But once you run up the tree, and now you want to start to eat your sandwich because the bear is now gone, you want to be able to swing out of the sympathetic and into the parasympathetic. But the problem is when we have emotional issues, when we're in stress, we end up many times having uptight fight or flight and filtration digestion at the same time. So now we start to create holes in our stomach, and we can't rest, and our circadian rhythm starts to mess up, so we're not having energy in the morning and then relaxation in the evening. It all functions in that autonomic system. So the autonomic system controls the nervous system behind the scenes through the conscious and subconscious. We most find, though, that the subconscious is what drives the autonomic system. So I can walk into a room. Let's say I walk into a chiropractor's office, and all of a sudden I go up tight and my eyes dilate and I start to sweat and I'm ready to run from a bear. Well, it just happens that maybe when I was 9, I went to a chiropractor's office. I had a hurt neck, and it scared me because he adjusted my neck. He cracked it. So it's coming out of subconscious memory of when I was 5, now eliciting the 9-year-old response of sweating and uptightness. That's coming from subconscious. So the third point here, in order to balance the emotional side, sometimes we need to be able to remove emotional imbalance. And I would say sometimes, always. We always have to look at it because we are creatures of all of these experiences. We are a sum total of our subconscious and conscious emotions. So if we need to absolutely address, if we're working in that triangle, we've got to work and make sure that the subconscious is relieved. So unresolved emotions may affect a client's health when health protocols or treatments are not providing expected results. 2, the client experiences feelings of being held back. Or 3, there may be or may not be conscious emotions, though they will often feel emotional. So they may think, well, gosh, I feel okay, but I can't think of anything wrong in my environment right now. Nothing. I'm not fighting with my employer. I don't have any trouble with my spouse. But man, I just can't get on top of it. That would be subconscious emotion. So the emotion release technique that I use, and that just is not any brand name. There's tons of emotional release technique, and I think there's even ERT is a name of a technique that's copyrighted probably, but it doesn't matter. Emotional release technique. You can call it what you want to call it. A very effective tool for the removal of emotions that cause autonomic imbalance can be achieved by way of emotional release technique. So here are my 5-step process of what I work with. So number 1, as a patient comes in, have the patient make a list of 3 different categories. 1, things they did that they wish they hadn't done. So let's say, let's go on to the next one. Things they didn't do that they wish they had done, and things that were done to them that they wish never happened. So now it's important to understand this. So these are things that they did. So when I was young, I teased a little kid, one of the kids in school. We all did, but I feel bad that I did that. So on this list, on my page, underneath did, I would write the word Kevin. Kevin, because Kevin's the guy that I teased. To the practitioner, Kevin doesn't mean anything. Let's say that I almost went too far with a girl in high school. I wouldn't put make out, I would put marry. Marry means something to me as the patient, but nothing to the doctor. So you're going to tell your patients to write things on the list, just one word representing each of the things that they did that they wish they had not done. So down that list there could be 10 words underneath did, representing 10 different experiences that they can remember in their conscious mind. Okay, the next thing is didn't do. I didn't get my Eagle Scout. I wish I had done. That still makes me feel bad that I didn't. I was right close, but I didn't finish it up. So I would just write Eagle Scout. And then things that were done to me that I wish never happened. Well, let's say that I was abused or whatever. So these are the things that happened to me that I wish never happened. Again, write a word that only means something to the patient, not to the doctor, because you don't want to have the doctor involved in any kind of judgment of the patient, because that will shut the flow down. So I always have them write something that means something to them but nothing to me. Okay, so that's the first step. Make this list. Second, use muscle testing to determine the priority from the emotion list. So as I'm working with a patient, I'll do kinesiology to determine what list we're going to work from that particular removal session. So let's say that I've got 10 things I did, 5 that I didn't do, and 3 that were done to me, those that I can remember. I would go down and use kinesiology, either pressing on the arm, doing arm testing, or I would do a test with inside me. Like you can pull your fingers apart, or you can push on a finger, whatever you do to do muscle testing to determine a yes or a no question. I've done this for 25 years, so now I just have developed it over time that I can check within me, and I'm sure many of you can as well. But I can sense a yes or a no. So I'll ask, is it in the first set, the first list, second list, or third list? And let's say I got a positive, yes, it was in third list. Then I would go down those 3 emotions. Is it the first one? Is it the second one? It's the third one. Okay, we're going to work on the third one on the list. You want to be able to query that, whether you're going to press on the patient's arm, or you're going to push on your finger, or pull your fingers apart, or whatever it is that you do to determine. You want to query the person to find out what emotion they're ready to let go of. Okay, so you can work down the list, determining the highest priority emotion to be worked on that set. Okay, once you've determined that emotion to work on, we do now what's called cross-crawl and conscious emotion forgiveness. That's step 3. So note, prior to doing the cross-crawl and Cook's hookup maneuvers, muscle check to the patient while thinking of the situation they need to clear. Thinking of the situation should cause their arm to go weak. Following the treatment, the arm should be strong. Okay, before we start, when I ask the patient to write these emotions down, many times they'll say, oh, I'm working with another therapist and I've done so much work here, I don't think I need to do that. And I'll say to them, I would recommend that we'd make the list anyway, and that we will then go down and one at a time have you think of that particular emotion. As they think of the emotion, if the arm is strong, then I'll make a dot by that particular word, meaning it's done. I don't have to work it. Because as they think of it, if it's clear, their arm will be strong. If it's not clear and there's still conscious and subconscious emotions tied up in that experience, their arm will go weak because it creates a electrical storm in their brain as they think of that negative emotion. That electrical storm shuts off the energy in the body. The deltoid muscle that I was using as an indicator muscle, if I had the patient hold their arm out horizontally and I'm pushing down at their wrist, if their arm goes weak, that means that they're having a storm. They're having emotion about that experience that they're thinking of. So I'll go through and make a dot by those that are strong. We don't need to work those. So let's say they had 20 on their list. And we went through and cleared, and their arm was strong on 10 of them. Great, we don't have to work those. Now the rest of them we do. So prior to doing any work, cross-crawling or Cook's hookup, which we'll talk about, I would have them think of the emotion, push on their arm, and the arm would go weak if it needs to be worked on. Okay, so now we've isolated that they're going to think of the first word on the first list, which was Mary. Almost went too far with Mary in high school, and I feel bad about that. So think of Mary. The arm goes weak. Okay, good. Now, the next thing we're going to do is the cross-crawl and conscious emotion forgiveness. So while they're doing cross-crawl, this is a great example of what cross-crawl is. While doing cross-crawl, which is touching the right hand to the left knee, then the left hand to the right knee in a crossing action. While they're doing that back and forth cross-crawl maneuver, have the patient think of the emotion from the list while they forgive themselves, others involved, and allow others to forgive them. We're creating a circle of forgiveness. Now, those of you who are Christian or who are whatever you want to be, whatever you are, forgiveness is something that is taught within religion or within the higher realms of thought. To be able to forgive somebody, let it go. If you're Christian, you're involving the atonement. If you are Muslim, you're involving something else. Don't know what, but you're involving some kind of action or forgiveness. Forgiveness is the power that will eradicate the emotion. Okay, so you're going to forgive yourself. Okay, so I'm cross-crawling now. I'm forgiving myself for whatever happened with me and Mary. I forgive whatever was going on, hormones, whatever. So I forgive myself. I forgive others. I forgive Mary and anyone else, maybe boys in the locker room talking dirty, whatever. I forgive all others associated with it, and I allow other people to forgive me. Anyone else who I've affected. Maybe I felt bad about what happened, so I was different with my friends the rest of the day that day. So when you create a circle of forgiveness, you have really brought in intense energy, and that forgiveness will override the negative that you were feeling. So on the second point here, creating a circle of forgiveness is true forgiveness. Cross-crawling brings the right and the left side of the brain together through the corpus callosum. So that's the idea of the cross-crawl. You're bringing that, and it's connecting up both right and left side, both the right and left hemispheres. Now you're doing the forgiveness process. Now you're way strong. Okay, so once you feel that it's clear, you stop the cross-crawl. So you could actually say, okay, stop. Think of that emotion. Think about what happened with Mary, and hold your arm out strong. And what you want to say to them is just hold your arm strong. Don't say the word resist, because that has negative connotation. So you just say to the patient, hold strong and meet my pressure. Now the doctor pushes down on the arm, and I push down like 1/1000. Like I push 1/1000 and lift up. If it's strong, it will not drop. If it goes weak, it's going to start to bobble or whatever. And you can practice with the patient first off before you even begin the process to know what a strong arm and a weak arm feels like. How I do that is I'll say, okay, think of sunshine and blue sky. Okay, now hold. And they hold, because everybody goes strong with sunshine and blue sky. Strong arm. Okay, now think of the emotion that you're, whatever. Think of, say your name is Brent. So my name is Troy, but say my name is Brent. If I'm not Brent, my arm is going to go weak. So I practice with them so that they know what strong arm is and what weak arm is. Now after they finished up the cross crawl, I'll say think of Mary. Push. Okay, that's good and strong. All right. The fourth step, let's go into the third. I forgot I had this page. Keep track of the emotions or situations cleared during that treatment. Have the patient go home and create a list of all the things that they've learned from the experience and how they are a better person from that experience. If we don't get the second point here, if we don't learn from the experience, it will repeat itself until the patient gets the get, until they learn from it. Why am I a better person? What would I do differently here? Because if we think about the opportunities for growth, if I call that opportunities for growth, if we sin, if we go too far with a girl, if we steal, we tease Kevin, whatever it is, if I don't learn from it, then why am I here on earth? What am I doing here? So my opinion is we're here to progress, to have opportunities for growth. See our quote unquote sin, turn it from a sin to an opportunity for growth. Apply the forgiveness process. If you're Christian, apply the atonement. If you're Hindu, apply the whatever. There's something bigger. I just don't know what they are. Apply that in yourself. Get the get and go on. So keep track of the things you've worked on that day with the patient. And you might clear 3 or 4, 5 maybe, within a 15-20 minute visit, and then have them go home and write. Have them write about what happened and why they're a better person because of it. Okay, have the patient go into Cook's Hookup by placing one foot over the other at the ankles. Cross one wrist over the other and interlacing the palms and fingers together and placing the tongue to the roof of their mouth. This is called Cook's Hookup. Now, you don't have to bring your arms up to finish Cooks. You can't keep it down like the left model shows. A lot of people then raise their arms up to their chest. But this is Cook's Hookup. Cook's Hookup turns on all 7 of the major chakras. It opens up and balances those chakras is the idea of Cook's Hookup. In Cook's Hookup, we're now going to apply the subconscious list. This list has been altered and changed by me, but I got this from the empty mortar technique. The BEST stands for Bioenergy Synchronization Technique. Great technique. You study it, that's where I learned and started, and then added just whatever else I wanted to, as we should, I feel. So this is altered and changed and switched and whatever, so it would consider my own work, and there you go. So on this left side, positive feelings, and on the right side, negative feelings. So on the positive side, we actually want to find the negative feelings first and then override them with positive feelings. So using muscle testing, you can push on the patient's arm, you can push on your finger. I have just a sense inside me, I can say yes or no. Okay, determine what negative emotion or emotions are associated with the conscious experience that they need to let go of. Use this emotion chart. Okay, so our conscious back on cross crawl was dealing with Mary. I went almost too far with Mary. So is there a subconscious emotion I need to work with? Do I have a yes? Okay, I get a yes. Then I'm going to break this chart in the negative side up into ABC or DEFG. So I say, is there an emotion up? Up would represent A, B, or C. So if I get a yes on up, then I'm going to say, is it A? No. Is it B? No. Is it C? Yes. Okay, is it C first side? No. Is it C second side? Yes. Is it C6, C7, C8, C9? So I get C9, and interestingly enough, that's very, very amazing, because this, I haven't practiced or used this chart. But C9, negative side, is immoral, interestingly enough. And I wasn't looking at the chart as I was doing the kinesiology just then. That's amazing to me. So anyway, I would have then, while in Cook's Hookup, I'm going to have them think of the word immoral. Okay? And with learning it with the mortar technique, you hold your breath. While you hold your breath, it's going to create a higher intensity of energy inside your body, because your body's got to search for oxygen. If it can't find any more oxygen anywhere, it's got to either breathe or it's going to die. While you're thinking of the word immoral, okay? So I say, okay, think of immoral, take a deep breath in and hold. While they're thinking of immoral on the negative emotion, I'm going to go over to the positive side and say, let's override now the negative emotion, or override the negative with the positive emotion. So again, I would say, is the emotion in up? No. Is it in down? Yes. Is it D, E, F? Yes. It's F. I get a positive on F. Is it F up? That would be the first side, no. Is it F down? Yes. So F down would be 6, 7, 8. So I get F8, which is virtuous. Interestingly, that's amazing. That is simply amazing to me. So F8 would be virtuous. So we would override the negative feeling of immoral with the positive feeling of virtuous. So I want you now to think of the word virtuous. What we're doing here is, as that negative thing was happening with Mary, there was a subconscious feeling that was overriding it of immoral. And my virtuous thought was also getting bushwhacked at that same time. So now what I'm going to do is override immoral with the positive of virtuous. And as I think of it, immoral is taken care of and virtuous can now become a positive emotion within me. So I don't have to feel that every time I'm trying to be virtuous, oh wait a minute, I'm going to get bushwhacked trying to be virtuous here, but I slipped. Okay, so virtuous is the emotion that overrides. This is the subconscious part. Cross crawl is the conscious. This is the subconscious. Okay. There's many emotional lists. You can get on the internet and find all kinds of emotional lists, but this one is good, and I like it. But that's really amazing to me. And Mary never happened. Actually, it was another girl, but that immoral and virtuous is what needed to be overridden. And that's how you do that. Okay, so you're going to work on it from the emotion chart. So that's step 5. So using the muscle testing, Using the emotion list, find the negative emotion first. Have the patient think of this emotion while you find the positive emotion from the list. Have the patient think about replacing the negative emotion with a positive emotion. Have the patient also hold their breath while they think of each emotion. This will help create a greater priority and help clear the emotion. Once they've finished this, you can ask, is there another emotion associated with Mary? Yes, then do the same applied technique. Find the negative emotion and then find the positive emotion to override it. Okay, they do the second time. They need to clear those two emotions. At the end of that, you would say, is there another emotion subconscious with Mary? No. Okay, good. Now I would have them come out of Cook's hookup, hold their arm out, and have them think of Mary. And their arm should be strong now at this point. And that's all there is to it. Cross crawl and Cook's hookup. During cross crawl, you're having them think of Mary and forgiving themselves for what happened, forgiving Mary and others, allowing others to forgive me, creating the circle of forgiveness. Now the circle of forgiveness is clear. Have them go into Cook's hookup. Ask if there is a subconscious emotion. If there is, go to the negative side first, find the emotion, and then go to the positive side and find the emotion. Now in Cook's hookup, you're going to have them take a breath in, think of the negative emotion, and then you're going to override it with the positive emotion. Okay, while in Cook's hookup. Then when they're done with that, and you've checked to make sure there's no more, it could take 2 or 3 cycles of the emotions subconscious before they're clear. Once they're clear, have them stand, push or pull their arm out. If their arm is strong as they think of Mary, it's done. Now you can make a list of the things. So Mary might be one, maybe an abuse would be another one, and maybe they didn't go to England. Was it the third that they didn't do? That you worked on that day. Have them take that list home and write. Why am I a better person? What have I seen? What's actually gone on? So using the muscle testing, sometimes it's necessary for the patient to do physical movement to let go of the emotions, such as throwing socks at the wall or beating the bed with a rolled up towel. I even had a patient, I didn't have her do it, but I had a patient who, I should have put who, broke all of her dishes on a tile floor. Not recommended. But that's what it took for her to express those emotions. She literally went home and broke her china on the tile floor. I said, dude, whatever floats your boat, man. But that's what she had to do. I'll sometimes tell people, maybe go up the canyon and throw rocks off the cliff, or go hit a bucket of golf balls. This third point, you can also program new behavior patterns using the cross crawl and maneuver while they are visualizing the new behavior. This can help fill the hole left by the removal of the negative emotion. So you let the conscious emotion go and the subconscious. Now what do you want to program in positively? Okay, think about being a steadfast, strong, moral man. What does that look like to you? And as you visualize that in your head, do a cross crawl. That's going to bring the right and left side to the brain together, and you're going to go very well. Supplementation. While you're doing this, it would be awesome to do various supplements. Serologic is by Inno-Vita. Serologic is tremendous at helping to create new pathways. Sometimes we will take the same slippery slide slope down. Our neurotransmitters, our neural pathways will follow that same slippery slide. Okay, so you're going to come across the behavior list. So let's say that you have an issue with pornography, which so many people do, and it's so corrosive to our society, our world society. And so every time you turn on the computer, you go down the same slippery slide and go look at porn. Using serologic can help support and recreate new neurologic pathways, filling in the old pathways, filling in the old and recreating new. It can help just so many things with your brain. IntelliMem also works with memory and just neural pathways. So those two together could be just tremendous. The other ones that I thought of would be hypothala. Hypothala is the brain control of your endocrine system. So hypothala would control the pituitary as the gatekeeper. The pituitary then can control the thyroid, the adrenals, all of that. So hypothala is very important in this process, and adrenax, because usually these people who are emotionally distraught or who have a lot of stress emotionally will have low adrenal function because their adrenals are constantly being pushed, constantly being pressurized. So the adrenax would be appropriate. And then I'm not sure if I mentioned Nerval, but the Nerval works with repairing nerve tissue. So kinesiologically check. Always use kinesiology. If you're just throwing supplements and not knowing for sure if they need it or not, then you're missing. You're missing out. You're just going on your feel, which is great, but to be able to double check it with muscle testing is so vital. I wish so much that our medical friends would do the same, because then we would cut down on all the kinds of interactions, drug interactions and drug reactions. And then we're not just looking at the patient's body, but what is their liver? How much can their liver express or handle? Can you detoxify the effect of this? So muscle testing, in my opinion, must happen. It's sometimes difficult, and sometimes we don't do muscle testing because we have to teach the patient what it's about, why it works. It looks stupid. They're going to go home and tell their husband that, you know, he pushed on my arm and told me I need 5 of these bottles, and they all cost 25 bucks a piece. And here, I spent 150 bucks, dear. Well, you got to stand up, stand in the power, stand in the light, and go forward. But it's not scary if you'll take a minute and express to your patient how it works. This isn't voodoo. It's just electric and magnetic energy. And when I put the right supplement in your hand, which is correct for your weakness, if I touch your liver and your arm goes weak, and I put a bottle of Livergy to your liver, and the arm goes strong, they're going to say, what was that? Well, electrons, protons, and neutrons are in orbit. Your body knows what it needs, and if I put the right supplement to you, it's going to electrically balance you. It's going to electrically bring up the energy again, and the energy that your arm was feeling when it went weak is now turned up by putting this next to you, this bottle of supplements. Well, how does it go through the glass? How does it go through the plastic? Electrons, protons, and neutrons of the glass are in orbit, as is the plastic as well. You have to take some time to express it, to teach them. But once you teach them and they understand, it's like, doctor, let's check that to make sure that I need it, and how much do I need? And once they feel, this makes my arm strong when I hold the Livergy. Okay, how much do I need? 1, arm goes weak. 2, arm goes weak. 3, arm goes strong. They're like, whoa, their eyes just get big. So I need 3, doc. Is that right? Yes. So what do you think the compliance is after you've done kinesiology? It's immense. The compliance is much better because they know that it works. They felt it. And now they can go home and say, you know what, dear, I'm not exactly sure how this works, but I felt it. And now that I take it these last 2 weeks, I feel it. It feels better. I have more energy. I'm ready to go. There are so many people that don't know about this good work. Chiropractically speaking, 1 in 100 people see a chiropractor. So I don't know what it is for massage therapy or for any of the other alternative care, if you say that, but competition is not. We don't have to worry about competition. There's so many people to educate and to work with. So if you have a feeling of competition, remove that from yourself. In chiropractic, there are a lot of techniques that do treat emotion, but to not medicate it, you see, now think about it, how many people are medicated because they have emotions because they were abused or they were yelled at or they were standing in front of a crowd and they had to give a speech and they flopped. All of those emotions are there. But if you practice this and practice with your friends or your neighbors, your staff, you'll feel more comfortable in practicing it, and ultimately people will search you out because you'll be able to help with the cause. Not that it's a lack of our psychotropic drugs. That's not the cause. It's not a lack of their antidepressants or anti-anxieties. It's not a lack of those that's the cure. It's getting the emotions out that's the cure. So anyway, I've just been really humbled to have been led through my practice these 25 years to different learning opportunities and practicing them in practice. So